We asked Harvard Chan School alumni how the Harvard Chan School prepared them for their career.
It definitely provided me the quantitative skill set that a researcher always wanted to have.
It gave me the appreciation for for populations and for thinking about what does the broader world look like? How do our actions impact them?
You know, pediatricians are primarily concerned with keeping children healthy. Unlike a lot of other doctors, our job is to prevent disease. If you look at the things we need to do to address climate change, namely reduce our use of fossil fuels, stop chopping down forests, these things have huge health benefits right now, particularly to children.
I had a number of professors who clearly experts in their field with real world experience that could effectively communicate that in their classes.
I also feel like some of the statistical and just data background overall has been really important, just in terms of looking at studies. When people want to know the latest vaccine study and what it actually shows, what's the efficacy, but also what does that mean for severe illness, and how do I translate that to the general public so that that information makes sense to them. Those are some really important lessons I think that I learned at Harvard T.H. Chan School of Public Health.
I got exposed to this cross-cutting global health issues and the perspectives of like my peers and faculty. So, which I think is very important if you are working in the area of global health, to appreciate and value those different perspectives and work collaboratively.
My time at HSPH prepared me a little bit for the pandemic is keeping your eye on the population.
I remember how much attention had been put onto the H1N1 pandemic, and that has some real resonance with the present moment and the pandemic from COVID that we're dealing with today.
I really loved Mark Lipsich's classes on mathematical modeling of infectious diseases, and it has served me well because over the last year, when we didn't fully understand what was going to happen, especially at the beginning of the pandemic, we were seeing what was happening in China, but not knowing how that was going to translate to the United States and how different interventions could impact the spread, and that there was a lot of mathematical modeling studies coming out because that's all we had.
To think in a different way, like to approach that problem from 2 to 3 different angles, give you like a more ground to think upon.
I took a leadership class at the Harvard T.H. Chan School of Public Health. There's times to kind of jump in and try to lead something, and there's other times where like, okay, what do people need me to do, and I can fill those roles.
And I think leaders are servants of the people, or servants of what needs to get done. And I think the opportunities I've been given have been a little bit about what can I do, and how am I able to fill in wherever the gaps are.